Chimpanzee attack victim who got face transplant is hospitalized. A woman who underwent a full face transplant in 2011 after she was mauled by a chimpanzee was back in the hospital on Wednesday after her body began to reject the transplanted tissue in her face, doctors said. Charla Nash, 62, was participating in a research study designed to determine whether tissue transplant patients could be weaned off traditional anti-rejection drugs when her immune system began to attack her facial tissue, Brigham and Women's Hospital in Boston said in a statement. Miss Nash was in no danger of losing her face, however, Dr. Bhavan Pamahac, the hospital's director of plastic surgery transplantation, said in a statement. He said she was experiencing a moderate rejection episode. The viability of Charla's face transplant is not in jeopardy, he said. Overall, she is doing well. Miss Nash lost her hands, lips, nose and eyes when she was viciously attacked by a friend's pet chimpanzee in Stamford, Connecticut, in 2009. The animal, a 14-year-old named Travis who was something of a local celebrity, was shot and killed the day of the attack when he opened the door of a police car and threatened an officer seated inside. Miss Nash received a full face transplant at Brigham and Women's Hospital 2 years later. She got a new forehead, nasal structure, nose, lips, nerves, facial skin and facial muscles. Her sight never returned. Doctors also performed a double hand transplant but both hands failed to thrive and were removed, the hospital said. With Miss Nash's body beginning to reject her face, Dr. Pamahac said she would be removed from the research study.